Providing proper aid to battlefield casualties will not only prevent mission failure, but will increase the effectiveness and entertainment of your team. Nobody likes staring at a black screen. It is essential for every TFT member to have all 4 medical steps memorized. There are 2 ways to begin treatment, with global interaction and the medical menu. The medical menu doesn't always work, so it will not be taught because of its inconsistent performance. Step 1. Identify if the casualty is alive. Look at the patient, and if their name appears green, they are alive. If the name appears gray, they are dead. If the patient is alive, move on to Step 2. If the patient is dead, gather their dog tags and continue with your immediate tasks. Give the dog tags to the squad's medic whenever available. Step 2. Assess wounds and stop the bleeding. Bandages are used for wounds located at the head or torso, while tourniquets are used to cut the blood flow of limbs. Bandage head and torso wounds, then tourniquet wounded limbs regardless of injury severity. Bandages require several uses to stop the bleeding, while a tourniquet stops the bleeding immediately. Never bandage wounded limbs. Once the bleeding has stopped, move on to Step 3. Step 3. Get a pulse. Interact with the head or torso and check the patient's pulse. If the patient has a pulse, move on to Step 4. If they lack a heart rate, the patient is in cardiac arrest and requires epinephrine following CPR. Call for a medic and provide CPR until he arrives. If you are the medic, this is when you administer saline. Never put saline in a tourniqueted limb. Step 4. Evacuate the casualty. Carry and place wounded personnel into a friendly vehicle by global interacting with their interactions option. To load a casualty into a vehicle, move to an appropriate location and press left click, or drop the patient on the ground, go to their interactions option, and go to load patient. Any vehicle that is marked with medical symbolism auto-heals patients within 5 seconds of embarkation. If combat or medical vehicles are unavailable for casualty evacuation, simply pull them back to a safe area. To conduct self-aid, self-interact and go to medical. Adenosine counteracts the effects of epinephrine. Elastic bandages are more effective at treating wounds but have a higher rate of breaking, causing a wound to reopen. Quick-Clot bandages are your standard combat gauze carried by most personnel. Body bags are used to identify friendly, hostile, and HVT losses depending on ROE, mission, and event. Epinephrine counteracts the effects of unconsciousness. Morphine counteracts the effects of pain. Never combine epinephrine and morphine, and never give an unconscious patient morphine. Personal aid kits are used by medics on wounded personnel to finalize the medical process. Saline is used to counteract the effects of blood loss. Splints are used to assist fractures, lowering the personal aid kit treatment time. Surgical kits are used to close bandaged wounds, which will also lower the personal aid kit treatment time. Tourniquets simply cut the blood flow of limbs, as previously stated. Wounded personnel in doorways block infantry movement. This concept is known as body blocking. If somebody is wounded in a doorway, immediately drag them, rotate 90 degrees, and release. This issue can commonly occur in choke points like stairwells and hallways. Feel free to train alongside this video within TFT's training server. Good luck.